for your interest in Explore, a program that it seeks to empower, expand, and promote leadership opportunities, resources, and education in healthcare for high school students. My name is Dr. Sherry Pinkstaff, and I'm the co-director of Explore and the chair of the Department of Physical Therapy at the University of North Florida. My own journey to physical therapy school started during high school when I had an after-school job at a physical therapy clinic in the small rural town I grew up in. Before that, I didn't even know what physical therapy was. No one in my family worked in healthcare, and I didn't have much exposure to different medical professionals. In fact, I went on to be the first person in my immediate family to graduate from high school and the first person in my extended family to go to college. And all along the way, I was convinced that I was the only person experiencing the fear and uncertainty that comes along with being the first. It's been a goal of mine to make healthcare careers more accessible to more students from every background, but especially those who are not well represented already. We created this video so you can hear students from diverse backgrounds discuss what and who inspired them to pursue a career in healthcare. They will explain what it's like being in PT school and why diversity and representation is important to them. It is my sincere hope that you can see yourself in some of their stories and can imagine yourself following in their footsteps.
Hello, my name is Dr. Bevan Livingston, and I am an associate professor in the Doctorate of Physical Therapy program at the University of North Florida. I am also the director of the Student Success Program. This program was established to help all students successfully navigate their journey from being an undergraduate student to becoming a clinical professional in physical therapy. Today, we are going to talk with some of our very own students so they can share those experiences with you.
So I want to know a little bit about you. So tell me your name and where you grew up.
My name is Bianca Gallegos. I grew up in Jacksonville, Florida, and I moved to St. Louis, Missouri in high school. My dad and his family are from Mexico, and then on my mom's side, her mom is from Spain, and then her dad, so my grandpa, is from the Philippines.
My name is Samuel Jaramillo. I grew up here in Jacksonville, Florida, but my parents immigrated here 25 years ago from Colombia, so I'm a first-generation American.
My name is Marcus Alexander Hayes, and I grew up right here in Jacksonville, Florida, Duval. I was raised by a single mother and my grandparents.
So my name's Yesenia, and I grew up in South Florida, but my family's from Cuba, and they migrated when my mom was 7.
Did you think about your career while you were in high school?
I'm definitely a big planner. I love planning ahead, so I honestly have been thinking about what to do with my life since I was probably in like 6th grade, and it's changed, over the years for sure. I always knew it would be something in healthcare, something about treating people or doing something that's felt impactful with my life.
In high school, I was pretty active, so I knew that I didn't want to be sitting at a desk. And just like me participating in a lot of sports, I kind of really enjoyed learning about like the human body. So I kind of had a gear towards healthcare.
I did think about my career while I was in high school. I didn't know exactly what path I wanted to take, but I knew that I was interested in the healthcare field.
What influenced your career choice the most?
I had a really good science teacher in high school, so that's kind of where the health science interest came from.
I come from a line of therapists, so that's pretty much what influenced me the most. But what cemented it was doing observation hours and just kind of seeing the day-to-day interactions between therapists and their patients. You really made a relationship, and it really seemed like a kind of like a team experience that I was really familiar with sports. To really try to get both parties to excel.
What influenced my career choice the most just has to be my family, really. And it's not necessarily that I had family that worked in healthcare professions. I kind of went on my own path with that, but what I think it was just this sense of caring.
So what is your most favorite area of clinical practice?
My favorite practice setting in physical therapy is kind of a tie right now. I really love pediatrics, which is working with children. And what I loved so much about it, there's a couple things. One was the creativity that comes with working with children. You know, you have to make it fun. I mean, for all your patients, you want them to have fun in physical therapy, but with kids, you want to keep them engaged, and half the time I feel like you want to hide their therapy in a game so they don't even realize that they're working. Another reason why I love it is because I feel like you're working with somebody so early on in their life that your impact has such a long-term, you can change the course of their life. You can really get them engaged in sports, start lifelong habits that can impact the rest of their life regardless of how they present to you with or what condition they might have. On the other side, I also really love geriatrics, which is working with elderly population. My reasoning for that is I just love talking with elderly people. I think that they have so much life experience and so many stories to share that you can always learn from.
When and why did you decide on physical therapy as a career?
So I was leaning towards health science, and the university where I got accepted, Florida A&M, they happen to have a pre-physical therapy program, which I didn't know much about physical therapy at the time, but I didn't quite want to go the nursing route, and medical school sounded intimidating, so I kind of looked into it.
I chose physical therapy as my career my junior year of college, so that seems like it's kind of late in the game, but it really wasn't. I knew that I wanted to be in healthcare. The summer before junior year, I was home in St. Louis for the summer, and there was this camp through St. Louis Children's Hospital called Camp Independence, and it was with the physical therapy department there, and it was a camp for children with cerebral palsy, and I love working with kids. So I thought it'd be fun to just volunteer and spend some time with them. And it was supposed to be 2 weeks, but I ended up spending a month there because I was so obsessed with it. I loved working with them, and I left knowing that physical therapy was what I wanted to do.
What's your experience been being a minority in physical therapy school?
Being the minority has been different, but also very welcoming, and I love the program here. The faculty, my cohort, they make the change very comfortable.
That first semester, there was a lot of self-induced pressure to, make sure I perform. I'm not the weakest link. I don't make myself, my family, or, black students who come after me in the program look bad. But as I said, over time, I kind of got into it.
I have to say that on the surface level, I don't necessarily see a difference in being a minority in PT school versus, let's say, high school. What I can say has been a different experience is the conversations that I've had in PT school. So at this point in our education, we're all here because we want to be here. We're here because we want to serve others and make an important difference. And I think that's led to a lot of conversations about my experiences as a minority or the experiences of my family and my friends.
Why do you think it's important for more underrepresented minorities and other groups to pursue careers in healthcare and specifically in physical therapy?
I think the very unfortunate reality is that minorities, people of color, don't get equal services when it comes to just healthcare in general across just the entire country. They're underrepresented, they're mistreated, misdiagnosed, and they just don't achieve those same positive health outcomes as consistently as Caucasian Americans. So I think the best way to counter that is to, again, recruit more people of color into healthcare professions, not just physical therapy, but physical therapy is a good one, to just learn and educate themselves so that they can convey that knowledge back to their communities where they came from.
I think it's important for more diversity in healthcare because the patient population is diverse. I think people that come from different backgrounds bring different experiences and different knowledge of different cultures, so that they can best serve the diverse population that needs healthcare.
I think it's important for minorities to choose healthcare field positions because everyone likes to feel represented. So they would like to feel that someone there understands what they're going through. They can speak their language. They can identify better with them and feel more comfortable when they're seeking these services that may feel a little bit uncomfortable to be in. As well as for the future generations, it's important for them to see that people of color and minorities are able to be in these careers, and if they have examples and role models they can look up to, it shows that it's possible and they can feel a little bit more confident in their abilities.
I definitely think it's more important to have diversity in healthcare. And when I think about why, I think about my grandparents. So my grandma is from Mexico and really only speaks Spanish, very bare minimum English, and she lives in Texas. When she would go to her doctor's office, who only spoke English, they would have a translator there for her. And she was so intimidated, she was nervous, she was scared to ask questions, and when she'd leave, she left feeling like she didn't want to go back because it was so difficult and really an isolating experience for her. So there's that one side. And then I think about my grandpa, who's from the Philippines, and anytime that he's been in the hospital, if he ever had a Filipino nurse or a Filipino doctor, I've seen firsthand just the ease of comfort that comes over him, and he's instantly more comfortable. He'll talk to them. Sometimes they speak in Tagalog, his language, and he just feels so much more comfortable. So I've seen the impact that it has on people to feel like you're represented in healthcare.
So who do you follow on social media, and what areas interest you in terms of career aspirations of the people that you follow?
I follow a lot. Half my Instagram is now physical therapy stuff. I think it's just important to follow a wide range of therapists and healthcare providers, especially ones that maybe you don't agree with, because I think it's important to see kind of both sides of each argument to really make you think about your position on that and really give yourself like a biased opinion and make sure that you're not just feeding into your own biases and confirming your own suspicions.
I follow a couple different people on Instagram. One of my favorites is Dr. J Pop. She is a Black physical therapist who works in pediatrics, which is my interest. And she talks a lot not only about her experience as a physical therapist and some different activities that she's done with kids and ways to make it fun, but also a lot about allyship.
So I follow a lot of accounts. I follow NeuroFit360, which is Guy, and he's very inspirational, and he offers like continuing education courses and stuff like that he likes to go above and beyond, like not only for his patients, but to help the field continue to progress, and he's very inspirational to me. So NeuroFit360, check it out.
So what advice may you give to high school students who are thinking about and possibly interested in a career in healthcare or even possibly physical therapy?
Definitely take advantages of opportunities to get your feet wet, to just get into a facility or a program, whether that's part-time work, volunteerism, or just shadowing a healthcare professional, because that observational experience is going to help you.
My advice would be to be open-minded. Just go out there if you can and explore different locations of therapy.
My advice to high school students who are considering a career in healthcare is to get out there and try and get as much experience as you can, and to be open-minded. I know it might be a little different with COVID and a little bit harder to get in-person experience, but another opportunity and possibly another way to do that is try and set up phone calls maybe with some doctors, nurses, physical therapists in your community, where you might have a list of questions you want to get answered just to learn a little bit more about what they do.
So I ponder on this question a lot because I'm pretty good at giving advice and not very good about taking advice, especially my own advice. But my advice would be to dream big, but focus on the small. A lot of times I notice as myself that it seems like I'm not really going anywhere. I'm working on all these little things, but all the little things, if you do them right, they really add up. So dream big and set goals, like ambitious goals, but focus on doing the day-to-day things right and do them well.
I hope you enjoyed hearing about these students' journeys. I hope you will continue your exploration of careers in healthcare. Please reach out to your teachers, guidance counselors, or me if you want more information on Explore.